Hello, my name is Bryson, and today I'll be demonstrating how to do an IV start and an IV push medication administration. So I already have all of my needed I already have all my needed supplies. I have gloves to work with the patient. I have my saline flush. I have a fill needle and a syringe for the medication, and I have my prep pads, tape, as well as the patch for the IV. And I also have my IV tubing right here. I don't have the original packaging, so I'm using this plastic bag as a placeholder. Let's see here. Yeah, and I have my all my tourniquets and all that stuff as well. And as I said before, the medication. Today we're dealing with Mr. Mingus. He has been dealing with post-op pain, and we have an order to go ahead and administer morphine for him while we have the chance. Now that we're out of the way, let's go ahead and introduce ourselves to the patient. Hello, Mr. Mingus. How are you doing today? Doing okay? All right. But before we get started, may I please have a name and date of birth real quick? Okay. Yeah, perfect. All right. And I'm looking at your allergies as well on the bracelet. Do you have any, I don't see you have any allergies, but do you have any allergies to sulfate, any latex or adhesives by any chance? No? All right, perfect. Well, my name is Bryson. Today we'll be doing your nursing care. I'm gonna go ahead and get an IV start going for you. An IV is relatively simple procedure. We're gonna go ahead and just insert a needle, insert a catheter into your veins. The reason why we're doing this is because usually through the bloodstream, it's gonna be an easier onset and or more faster onset of medication reaction. I understand that you've been feeling some post-op pain. In scale of 1 to 10, can you rate that pain? An 8, okay, got you. So we have 2 milligrams of morphine for you right here. I checked the drug guide. There's not gonna be any need for any dilutants or any of the sort. We're gonna go ahead and get that IV started, and then we're gonna go ahead and administer the medication over the span of 2 minutes. That is, according to the drug guide, that's going to be enough just for 1 milliliter. All right, I'm gonna go ahead and get you a more comfortable position right here. Just a bit lower. Okay, fine. I'm gonna go ahead and tie this tourniquet around your arm here real quick. Make sure it's tight. Go bottom right here. Okay, perfect. I'm gonna go ahead and just feel for a pulse here. Okay, most good feel for buoyancy around the veins, or not buoyancy, but for bounciness on the veins, because it's going to be a prime place to go and do that. And I'm looking at the site as well. There's no any signs of skin breakdown or damage, so it's going to be a good site. Perfect. All right, let me go ahead and take this off. Okay, I'm gonna go ahead and get that site cleaned up as well. Okay, go ahead and clean it for 30 seconds. We're gonna do broad strokes to cover as much area as we can. Just for the sake of the video, we're going to go ahead and speed it up a little bit. Okay, put that out of the way. Go ahead and change out my gloves. I'm also going to prepare the IV tubing. Okay, perfect. And pull out our tubing right here. Okay, we'll go ahead and clean out both ports here. Okay, just gonna wipe this down. 30 seconds. Okay, I'm just gonna speed up just a little bit. We're gonna do the other port as well. Then after this, we're gonna go ahead and prime the tubing as well to make sure that's gonna be going through. Okay, 30 seconds again. And for the sake of time, we're going to just go ahead and speed it up. All right, now that we have that cleaned up, we're gonna let that air dry just for a second. And then once that's air dry, we're gonna say that it is. Go ahead and attach this flush right here to go ahead and make sure that liquid is gonna come through. Not too much, just to make sure this liquid is coming through. Perfect. Go through the other one as well. Second. Okay, prime it. Right, perfect. We got liquid turn back. We're good. We go ahead and place this safely back into our bag here. All right. We're already set up the IV site. I'm gonna go ahead and get started now on that. Let's go ahead and just Tie this up right here. Okay, there we go. Okay, now the site's fully dry. We're ready to go ahead and start our IV catheter. Grab one right here. Okay, ready to go ahead and get it started. Bevel up because the tab is on top. Oh, no, you will want to throw that away in the sharps container. Okay. Perfect. All right, we have that set. We're gonna throw this away in the sharps container when we have a chance. Then we'll go ahead and grab our IV tubing here. We're just gonna go ahead and release this as well and attach this. Okay, I'm gonna grab our saline flush. We already cleaned the ports up. Go ahead and make sure that there's gonna be blood draw back. We're gonna go ahead and aspirate. Okay, go ahead and pull this in. I'm gonna pull it back, see if there's gonna be blood draw. Positive blood draw, perfect. I'm gonna go ahead and flush like 3 milliliters in a pulsating motion. Okay. Okay. Okay, perfect. All right, this right here. I'm gonna go ahead and attach our tab right here. I already have the my initials, date and time and gauge of the needle. Right there. This. Find out any bumps right here. And go ahead and attach our name to this as well. Okay. And then we have that in place. We can go ahead and grab some tape to attach our flushes here. Okay. Just gonna go ahead and grab this tape, place it right here. Right. Do the same thing right here as well. Just one more tape here. Okay. Here. Just place. Perfect. It's a bit wonky, but it'll be fine. And I'll go ahead. This did touch the table, but we're gonna go ahead and just wipe it one more time before we administer medication. So, Mr. Mingus, we took your vitals. We determined that you're within baseline, but after administration, we are going to continue to keep a check on that because, as I said before, morphine can cause respiratory depression. So your OT saturations and your respiratory rate can lower. So, as I said before, we're just going to go ahead and keep a tab on that, all right? All right, now that we got that out the way, let's go ahead and continue with the administration of medication now. Put on your set of gloves here. Let's go and do a check again. All right, so just to make sure, we have 2 milligrams of morphine for Mr. Mingus for pain, 8 out of 10. And we're going to go ahead and administer it right now. All right, let's go ahead and just scrub the hub of our medication vial. Okay, place it down just to let it dry. All right, and prior to this, I already done my research, and I know that we're going to go ahead, this drug doesn't need any sort of diluent to go ahead and administer. And I also know that typically for morphine, you want to administer it over a certain amount of time. So we're only doing 1 milliliter of morphine, and after doing calculations, we're gonna go ahead and do it over a span of 2 minutes. All right, let's go ahead and open up our medication here as well, or our syringes. Okay, there we go. A fill needle as well. Okay. Okay. Go ahead and double K method. Aspirate just a little bit here. Okay. Go ahead and just insert it here. Okay. Taking a full milliliter. Bubbles inside here. Okay, looks like we're having some technical difficulties. Looks like we're just gonna use this right here. It's an air bubble. Look at that. Okay, pull some of that back out. Okay. Bubbles. Okay. Go ahead and just here. Okay. Plug this. All right. Go ahead. We'll dispose of this with the catheter needle into the sharps box. And go ahead and just fix this up real quick. And we'll go ahead and wipe down our catheter site or our port because it did touch the surroundings. 30 seconds again, but for the sake of time, we're just gonna go ahead and speed it up. All right, perfect. Let's go ahead and reattach those right there. Okay. All right, just to make sure again, we have 2 milligrams of morphine sulfate for Mr. Mingus with pain, 8 out of 10, and he needs it right now, and we're gonna do it via IV pushback, or IV push. All right, I'm gonna go ahead and get started here. All right, Mr. Mingus, I'm gonna go ahead and administer your medication right now, okay? Hey Siri, set a timer for 2 minutes.
2 minutes, counting down.
Okay, going slowly, do a pulsating motion right here. Okay, perfect. Okay, now that we've got that done here, pull this off. Okay, we're gonna go ahead and just flush the same amount of fluid here. Just fix my watch. Same 2 minutes. Okay. All right. Just 1 milliliter over the span of 2 minutes. Just really slow increments. Really small pushes here. Perfect. All right. Okay, Mr. Mingus, we're done administering medication. So just some teaching points here. We're gonna go ahead and teach you here real quick. So just in case, if you start to feel any, start to get sick, start to feel fever, start to feel pain around the site, sign of infection, so please let us know that. Also for teaching on the morphine sulfate, it is a respiratory depressant, so if you start to notice any changes in your vitals after we take it, such as low oxygen saturation and or just a lower rate of breathing, again, please let us know. I'm gonna go ahead and keep that call light as well on you. You can just leave the flush there. Okay, I'm gonna go and dispose of this into the sharps box, and that concludes our procedure. We're gonna go ahead and document our procedure as I said before, and that concludes the video.